So that way we have a number of people who registered who just couldn't make it tonight, and they will be able to watch it. So it's all you.
Okay, well, welcome everyone. I'm so glad to be here this evening and to kind of give you some highlights of what TruDose PRP does for some of my patients. Just for some background, I'm a pediatrician, but we do family practice in our practice. And we brought in TruDose back in February of 23. So we've been doing it now for about 7 or 8 months. And so one of the things that we have been noticing is that there are certain disease processes that are really, really doing well and responding well. Now, let me just explain something, a little bit of something, because I think everyone thinks that, you know, it's a treatment plan. So it's not something that's one and done. So I just want you to understand that too. The younger the child, in our case, it seems like those kids are responding faster than the older population. However, everyone's getting some results. So that's actually a really awesome thing. So some of the people that are getting awesome results are people that have GI problems. So we have 2 young men that have clinical Crohn's disease or irritable bowel disease. Both of them, when they got their TruDose PRP, that was one time finished, done. Their GI tracts are great. They're both one's about 15 weeks out and still doesn't have any issues. And the other one got a second dose of PRP because that young gentleman also had chronic pain secondary to chronic infectious diseases. So, but he's doing amazing. Like the first time he came in, he was out of the hospital for, I think, about 24 hours. So he did no prep work whatsoever. When he reported his pain score was a 7 at the time in the office. Then he got the PRP. Now he did have something called a Herxheimer reaction. And a Herxheimer reaction is kind of like a detoxifying reaction. So sometimes it gives you a flu-like illness. In his case, he did a lot of vomiting, went to sleep, woke up the next day, and his pain scale went down to a 4. So in less than 12 hours, his pain scale nearly cut in half. And this is a young man who's literally in his early 20s. He was on 5 or 6 pain meds, 4 of which were controlled substances. So he was in very, very significant pain. When he was discharged from the hospital, he was actually in the hospital for 2 weeks because of a GI problem. So just so that you know, he was a very, very severe case. He got PRP twice. So he did it one time, and then 8 to 12 weeks later, he got it a second time. When he came in the second time, he had put on weight. He was looking really good. He had increased energy. He put some muscle mass on, because when we saw him the first time, he was pretty kind of skinny and mopey looking, for lack of a better term. And when he came back the second time, he looked great. He had been on vacation, and this is a kid who had been basically bedridden from the time he was 8 years old until he was 22. So the second time he got his PRP, within a week, he was off all pain meds. When he came in, he was only on 1 that second time, and he was only taking it if he absolutely needed it. So that's a huge improvement. We have done kids as young as 2.5. We have a 2.5-year-old who basically is legally blind, and we did PRP on him, and his vision had improved 5 points, to the point where his ophthalmologist really was concerned that he had misdiagnosed the child. So he's coming in actually next week for his second PRP. So I'll be happy to report back what his results are when he finally comes in and goes and sees his ophthalmologist, which we're just hoping and praying that he has similar results over time. His older 2 brothers are both autistic, vaccine injured. The 5-year-old was the most dramatic. He was nonverbal, very intelligent, but completely nonverbal, no spontaneous speech whatsoever. He did have some echolalia, which basically he would repeat words sometimes, but they really didn't have meaning for him. After his first PRP session, which was in February, before he even left our office, he went into what we call the treasure chest, which is where we keep little prizes for the kids. And he picked up a dinosaur and literally looked at it and went, huh, dinosaur. And his mother almost passed out right next to me. She was like, I can't believe he just said that. So within 5 or 6 weeks, he said his first 4-word sentence spontaneously with no prompting, just out of the blue. Mom had learned in those. Now his mother is amazing because she actually keeps a daily log of his improvements. She found out that he actually could read. Because one morning she had prepared his he decided that's not what he didn't want that breakfast. So he climbed down and he went into the pantry. He pointed to a box and told his mother tricks. So she was floored again because she had never bought that cereal before. She had not been speaking of the cereal or any of those things. And so that was pretty amazing that now she knows he actually can read. He makes eye contact now. He waves hello. He says goodbye to you. He has a long way to go, but he's been doing phenomenally. We have another 18-year-old young man who I've had as a patient since he was about 4, I think. He has severe cerebral palsy, nonverbal. He got his first PRP was actually not successful. He came in a second time and we were successful the second time. And when we checked in on him about 9 days after his first successful PRP, and we found out that it happened to be Easter Sunday. And now this is the cousin of the woman that I just told you with the 5-year-old and the 2-year-old. So they were at Easter Sunday dinner, and this young man who is wheelchair bound, who it's really difficult. Like, he doesn't make eye contact. He groans, he bites himself when he gets frustrated, things of that nature. He actually did something amazing. He pushed himself and got himself out of his wheelchair, used the counter space in front of him to ooch and scooch to where he wanted to go. So he was done with his meal and he said, that's it, I want to move somewhere else. And so those are just a few of the amazing stories. In adults, the young boy, the 5-year-old's mom and dad both had PRP as well. Now I need you to understand that poor family had not slept literally in about 7 or 8 years. Every night, one of the parents has to basically stay up to make sure that the boys do not try to escape the house because they did not sleep at night. After their first PRP, they both have slept through the night every single night since, which is life-changing for a family. Mom's anxiety the day after her PRP, she said she woke up like a totally new person. Her anxiety was gone. Her husband, who was suffering from long COVID with a lot of brain fog, which is very difficult in his job, woke up within 2 days and said his brain fog was gone. He had some neuropathy that was gone. So we've seen some really, really excellent results. So I'll stop there and see if anyone has any questions.
Hey, let's back up a second just for anybody who may not know what PRP is. Let's start at that point and kind of what is it and what's the process look like?
Okay, so PRP is plasma-rich platelets. So this is different than what you may hear. You may hear commercials or radio ads for regenerative medicine, and this is part of regenerative medicine. So the platelet in your blood is very powerful. It's very healing. It helps with it's called your first responder. So when you have inflammation or some kind of injury or whatever, those platelets go first to that site of injury. So these are your, like I said, your first responders. When the way we do PRP, this is different than like orthopedics PRP, for instance, because orthopedics PRP, they inject into a site like a shoulder or an elbow or a knee, but they only can inject about 1 cc of the platelets, of your platelets. They also have a different mechanism of spinning it down and things of that nature. So we actually isolate the platelets by spinning it down in a special format. And then we can actually test the platelet count to see the amplification rate. And so with TruDose, let me just give you a for instance. So if you came in, for instance, with a platelet count of 250,000, which is a normal platelet count, after the TruDose has been applied, after the mechanisms and the spinning down, we actually retest the platelet count at that point. And so a 250,000 can actually amplify to 2.2 billion platelets. Okay, so it's huge. So we're taking the little soldiers that are marching around your body, helping to repair things, and we're actually condensing them into an army. Now, and then when we re-inject it into your IV, this is all IV. So you get an IV stick, we draw out your blood, we spin it down, we amplify it, we retest it twice. We retest it the first time and the second time. And then from there, it's determined how much of your plasma you get back with your platelets. So generally it's somewhere between 6 to 9 cc's back into your bloodstream via your IV, okay? And the entire procedure takes about 45 minutes to an hour. Most of that time is waiting, you know, for the machine to spin and for the analysis to be done on both sides. And then, you know, we follow up with you the next day, and then we follow up with you the next week, and then we follow up with you at week 3, and again at week 8. Okay, when you come in, we ask the adults to fill out a functional medicine questionnaire, and that just kind of gives us an idea of, you know, what are your symptoms, what are the things that are really bothering you, where, you know, where do you rank certain issues, like, you know, you may have brain fog, but you really have significant knee pain, for instance. Well, your body has its own mechanism of prioritizing what gets fixed first. Okay, so even though you think the knee pain may be worse, the body may be saying, no, we have to go into the brain and clear the brain out first. Okay, so just so that you know, that's why we want you to track your symptomology very, very closely. Somewhere between 8 weeks and 12 weeks, we resend that same questionnaire out so that we can get an idea. Did your scores change? You know, did your symptoms change? How are you feeling? Things of that nature. So there's a lot of follow-up with this. You have the opportunity, if you so choose, to repeat the TruDose PRP starting around 8 weeks. So a lot of the improvements are things that you may not even notice initially. So, and what I mean by that is one of the things that is reported a lot in women. So as women get older, a lot of times when they sneeze or they cough, they have a little bit of urine incontinence. This is a pretty common issue in women that post childbirth as well. So anytime that you have a baby, but also once you hit menopause, this tends to be a little bit of an issue. Many women report that really improves significantly, really quickly, like within that first week. And again, it's something that a lot of people don't notice until we ask the question. So depending on the severity of your disease or your chronic problems, it is recommended that you may repeat this every 8 to 12 weeks. And I could give you a couple of for instances on that, but let me stop and see if anyone has any questions on that so far.
I have questions. I have questions. How do you do that?
Go ahead.
Oh, so I don't know. Hi, Molly.
Hi,
Andy.
how are you?
Great. I'm coming to your conference in few weeks, whenever that is. So my question is, because I don't know anything about this, what I've been doing during this last era, I'm a retired pathologist. I'm just connecting people with you guys, people like you, getting them help, connecting them with lawyers, doctors. So what I've been looking for, I have patients who are people, right? They think I'm their doctor. I'm not their doctor. I'm the neighbor. Elderly gentleman with Parkinson's is looking for help. My son, who has caught equina syndrome from a traumatic injury, paranoid schizophrenia, jumped off the roof. Okay, so he's got a paralyzed bladder sphincter closed, rectal sphincter paralyzed open, that kind of thing. Are those things that might help or worth trying or not? I mean, I'm not sure. Is this just for inflammatory conditions, this PRP?
Not necessarily. So, and it does help a lot with neurologic stuff. So we also have a young man who is 11 years old. He flies in from California to see us, and he has seizures, irretractable seizures. He also he got this, he has like an encephalopathy. He is not, obviously it's been 7 or 8 years, and this kiddo has suffered with these. He wears a helmet 24/7 for the most part. His seizures happen at very early hours of the morning, like 3 in the morning. And he has multiple every single morning. That young man came in for his treatment, and mom saw the frequency of his seizures just plummet. He was having 10 to 20 seizures daily, and they went down to 6. And sometimes he missed a day. The frequency and the duration actually decreased significantly as well. So he's another young man that came in and did it twice. And he's actually due for a third. So neurologic disease is a very good indicator for this. We have people that have come in with
So Angie, let me ask you,
Sure.
so would that cauda equina paralysis due to trauma, would that be an indicator or not, because it's traumatic?
Well, the body has a tremendous way of healing itself, right? So if you link PRP with like physical therapy, he may get some function back. We have had kids.
I don't know how you would do physical therapy of rectal sphincter because he's paralyzed there. He can
Oh,
walk,
no, yeah. Well, I mean,
walk,
he
he
can
can
do different.
drive, he can do everything except have rectal continence and pee without.
Well, he may regain function, so
do you think it's worth a try? That's my question.
yeah, I think so. I mean, look at the quality of life, like our young man who has cerebral palsy, who's, very severe. And honestly, his father referred to him as a potted plant. Like,
Yes,
that's how bad.
I'm just wondering if cerebral palsy is an inflammatory condition, whereas my son was a traumatic condition. That's why I'm, traumatic injury had a giant hematoma around those nerves that injured those nerves.
Yeah. Well, there's still inflammation around those nerves too.
Yeah,
So, I think it's worth a try.
And I know a woman, I know a woman from church. She's been, she had a lot of malpractice after a childbirth. Anyway, the bottom line is it was pretty bad, but she's got severe, neurologic pain, these bad headaches. I mean, she just can't get relief. She's gone through functional medicine stuff and had various injections somewhere out west and somewhere here and there, but I don't know if they did this specific one. I'm wondering if it's someone for that is worth doing this too.
I think so. I mean, again, these people have been suffering for years and years. And the way I look at it is, why not at least try it? Because with pain syndromes, chronic pain syndromes, we are seeing huge leaps and bounds on
Maybe I have to come in. I have to take another trip down to Molly's place there and get a treatment for me.
Sure. Yeah. I did it.
I know the route. I did it a couple times already.
Yeah.
So Angie, do you only do it, or Molly, do you do it, or you only do it when Angie's there, or?
Well, Angie's doing it at our clinic. So, yep. And then hopefully we'll be doing it after that.
All right. And Angie, you're flying up from Texas occasionally.
Yes.
Is that how it's working?
Yes. I come once a month for about 3 days.
Okay. Okay.
She's
And I'm
wildly
bringing my
popular.
team this next time.
Huh?
I'm
She's
bringing my
wild-
team.
Yeah.
Awesome.
So we do have a question on the chat, the cost or insurance coverage options.
Insurance does not cover any of that. The cost is $1,500 per session. Okay, so that could be every 12 weeks. So up to 4 times a year. And honestly, again, most of the people that walk in our door have exhausted a lot of out-of-pocket options. And it depends. You can always try. We have a few people that we fill out their billing forms, and maybe they can get part of it covered, you know, like the IV start or something like that. But honestly, it really is not going to be significant if your insurance even bothers to give you a little bit back. So this is completely out of the insurance realm, which is not unusual for things that tend to be, you know, a little on the edge.
At work.
Yeah.
So there's
I have
another
a question.
Sure.
So what about the kids? Like I have a friend that their child is 15. He ended up getting all of the vaccinations for COVID, unfortunately, has ADHD, is on medications, and then suddenly came down with migraines. They don't really think it's vaccine associated. I kind of do, but that kind of situation, would that be helpful for the migraines?
It'll be helpful for the migraines. It'll be helpful for the ADHD. If he has any learning disabilities, it's amazing for dyslexia, believe it or not. And I'm talking like within minutes, like their fluency changes. It's incredible. So yeah, I mean, we have a couple of kids now. Don't forget, a lot of our kids with autism, they have a secondary, what we call secondary comorbidity. A lot of them have attention deficit disorder. They have learning disabilities. And like I said, with our first little guy, the 5-year-old, I mean, mom had no idea that he even knew letters. She had no idea that he could read, and he was, you know, he read the box. And so that was pretty exciting for her. I mean, it was exciting for me too, actually. But when you're looking at anxiety, depression, a lot of attention deficit hyperactivity disorder is driven by anxiety, frustration, and a learning disability. So if you can kind of calm that underlying condition, I think it's worth it. Sure. And if we can decrease their medicine or potentially even get them off medicine, that's even a bigger win. It does help headaches. People have reported that their headaches were decreased, you know, on their questionnaires. Because like I said, I have them repeat their questionnaires every time. They do it at the time that they come in, and then they do it again between 8 and 12 weeks. We ask them to, you know, track their progress. And so, you know, I look at their scores, and with the one young man, so one of the guys that had the GI problem, when he came in, this was not the one with the chronic pain. This is the other one. His GI problem literally was gone within 7 to 10 days. And so I saw him, and at 8 weeks, he decided he wanted to do it again. So when he came in, his scores actually went up. So I sat down with him and I said, "Hey, you told me that your GI problems are, you know, gone and everything's great." And he said, "Yeah." He said, "But now that that's gone, I don't focus on it. So now I'm noticing, like, hey, you know, like the knee I hurt in sports when I was in high school is now predominant." And so, you know, so it's kind of amazing how that works. And then on top of that, he, when he got his second PRP, he said that that knee pain has actually dissipated quite a bit. He barely notices it.
Hey, there's a couple questions in the chat I want to get to just because they're
Sure.
piling up. So the first one is, does this work for neuropathy?
Yes, absolutely.
The next one, is it good for a diabetic with heart disease?
Well, let's see. So I don't see why it wouldn't help, because diabetes has a lot of inflammatory components to it. The heart disease part, I don't think it would be a big problem with either. We have a few people that are working on that. But we can get more research on that. I mean, we have to kind of know specifics. That's why in my practice, we actually ask the patients to do at least a telemedicine visit with us before they have their PRP, so that we know a little bit more about their medical history and what's going on, what medications they're on, things of that nature. And then some of them we do have to get clearance from their subspecialists. So we, you know, that's kind of just where we stand on that. We think it's very important for us to at least get to know our patient a little bit before we do the procedure. So that is something that we require in our practice.
So I think this is answered, but for the success stories, is it mostly one time and they're good for a while, or do they have to just keep coming back?
So the improvement happens over about 6 to 12 weeks. Okay, so some people will have, so there's such a huge spectrum of what goes on. The first night, a lot of people sleep extremely well. Just gonna put it, especially if you have problems with sleep. That was not my case. I'm kind of an insomniac, so that was not my case. I actually had trouble sleeping that night as well. But what did happen, now, when I did the PRP, I had neuropathy secondary to COVID. So post-COVID, I was having a lot of trouble with neuropathy in my feet and a lot of brain fog where I couldn't retrieve words, things of that nature. And so that was really one of the reasons why I did the PRP. And I also had a very sudden onset of floaters in my eyes. And so I figured, well, let me just try it, because there's also reports that people's vision improved. Now, I told you about the little boy whose vision improved significantly. I have, I could tell you within a day and a half, my neuropathy was pretty much gone. No problems whatsoever. I suffered from detox for about 2 weeks. I was very fatigued. But on day 14, I kind of woke up and all of a sudden the brain fog was gone. The fluency in my speech was better. I wasn't having problems retrieving my words. And really the neuropathy has not returned. I did mine in, I think it was April or May. So it's been a while. The other, I'm trying to think if there's another, like with our CP kiddo, right? Those kids lose function because if you don't use it, you lose it. This kid is contracted. I mean, he looks like he sits in a wheelchair, right? Like, so when he stands up, his knees are contracted, his ankles are contracted, but he had enough strength, and really the wherewithal to get out of that. He's never gotten out of his wheelchair on his own, ever. And so, there is some driving force there, that there's major healing going on in that young man. So, I think, like I say, I have the philosophy of potential. I just feel that everyone has potential, no matter what your age, no matter what your disease process. I think it's worth it. The reason why I brought it into my office really was for that child with CP, because I used to tell his mom all the time, I said, sometimes he would just look at you, and I would tell her, I'm like, I wish I could just unlock his brain. And there's some really excellent corroborating stories on that too. There's a cardiologist in Dallas, a pediatric cardiologist in Dallas, who was taking care of a young child who was basically catatonic, just wasn't there. She was wheelchair bound, drooled nonstop, moaned a lot, really didn't make eye contact. And the report from that young lady is just absolutely amazing. Within days, the drooling stopped. She was making eye contact. She was making purposeful movements. So it's really miraculous when you're thinking about it. We do have some patients that are not paying attention to their body. We do have some people that have really chronic disease, genetic disease. In fact, we have a woman who's a nurse. She has Ehlers-Danlos syndrome, along with unstable blood pressure. So her blood pressure will go super high and then it drops really low. And so she has a lot of problems walking. She has a lot of problems just getting around. She's been disabled now for about 6 months. Can't work, can't go back to work. We did her about 2 months ago. Within within 2 weeks, she actually left her house, which she doesn't normally do. She actually left her house and was able to walk around Walmart for a little while. I mean, that's huge. You know, everyone was shopping for her. She wasn't able to leave the house. She was in too much pain. Her pain symptomology dropped significantly. And this woman's in her late 50s, early 60s. She's actually well enough to care for her grandson. So, you know, these are huge, huge lifestyle advances, I think.
There's a couple more questions from the chat, and then we'll get to you, Dr. Narushkin. How many dyslexic patients have you treated?
So the TruDose team, I have three, I think I have 3 dyslexics and all 3 of them improved. And again, we've only started doing this back in February. We started in February. The TruDose team actually has on video a young man who's dyslexic, and they had him read on camera before his TruDose treatment, and then they had him read immediately after his TruDose treatment. I'm talking within 5 minutes, and you can hear and see the difference. It's just night and day. It was absolutely incredible. So it does, and he has many dyslexics. I don't know exactly how many. They are actually compiling a lot of that information right now. TruDose has been around for 6 or 7 years. So the man who enhanced this technology, he has a VAX injured son. And so he was one of the reasons for developing TruDose, and his son has improved greatly. His daughter has attention deficit, and she has improved amazingly. Like, she went from 0 organization skills, a big mess, handwriting was atrocious, to putting all of her stuff in a folder, keeping things very neat, great handwriting, more control, better school. So there's a lot to say about that.
Doc, do you want to ask a question? And I'll go back to the chat. So if you have questions and you don't want to go on camera, you can drop them there. We'll get to them.
Is it my turn?
Yes, you're up.
Oh, I was going to ask about chronic myofascial pain. You know, I've had it, I guess, from all the years of being a pathologist, and, you know, I deal with it lots of different ways. Tango dancing several hours a week, then go for a massage or sit, you know, a Epsom salt. But would that be worth it for me to try? I mean, that's what I've been diagnosed with. They just say it's chronic myofascial inflammation. I go to masseuse. She said, you know, that's what it is.
Yeah, I mean, again, anything that causes inflammatory responses in the body will benefit, I think.
Well, how about schizophrenia? I don't know if that's inflammatory. I don't know what the reason for that is.
So again, I mean, we know that there's improvement in things like stroke. We know that there's improvement in attention deficit, dyslexia, all the, you know, back in the day it was neurologic versus perceptual diseases. And so it's covering kind of both.
I guess it's worth a try, because you don't know until you try it. You're still collecting data.
Right. And I could find out more for you, for sure.
Yeah, well, maybe I'll just come down and see if it helps me at all, and then I can be a witness and maybe some other people with some other things.
I would have to say, I mean, and you can probably appreciate this as a pathologist, I feel like there is a lack of quality diagnostics across the board as far as doctors. You know, people will come to me with a stack of labs this thick, and it's all CBCs and BMPs and UAs. Like, there's just not a lot of depth of, you know, investigating things. I'm finding a ton of like reactivated Epstein-Barr, Lyme disease, co-infections. They're just not diagnosed. And those people have all kinds of various symptoms. You know, it can be across the board. So, you know, I think part of this is, and this kind of goes to what Gina asked, but I'll ask her question anyway. You know, there needs to be a depth of diagnostics and make sure that we've checked all the boxes on that, so that as we're doing the PRP, like, that's not going to do a miracle for Lyme. I mean, it may be very good, but then we need to get the Lyme stuff going too. So it's not just a single actor. That's my opinion, having not done it yet.
Right. And we have amazing results in Lyme disease. Amazing. So I'm a Lyme literate physician. I've been doing Lyme for 20 years in kids for the most part. some adults that can't find relief or help. And, you know, one of the investors in this company has had Lyme for 25 years, was misdiagnosed for over 20 years. And, you know, a year ago, she told me a year ago, she was lying on the floor, just wanting to die. Like, she couldn't move. She was in so much pain. If she did anything, it would wipe her out for like 3 days. And I'm talking about an hour to 2 hours or something. And it would wipe her out for 3 days. She was bedridden for 3 days. To see this woman now is just amazing. You know, she gets PRP on the dot every 8 weeks. She doesn't miss you know, every 8 weeks she is getting her TruDose treatment, because she noticed some improvement the first time, not phenomenal, but she could tell things were changing. But by the third treatment, she said huge improvements. It went from to amazing on that third treatment. So that's another, and she, you know, she went through 10 years of absolute hell, honestly. We have another lady who comes to our practice who has Lyme disease and reactivated EBV and mycoplasma. She came in with chronic pain, lots of brain fog, depression, anxiety, the whole gambit that goes along with it. And she has done amazing. She looks like a completely different human being now, and she's on her she'll be doing her third one next month. So for sure.
Yeah, a couple more in the chat here. 65-year-old with a vagus nerve stimulator that is dying off, had it since 2006 for resistance to mood meds. Any possibility? Is this for all neurological or possible rebuild of knees that are bone on bone with obvious inflammation? Thank you.
So we did our first, what I would consider super high risk person just like that. She has nerve stimulators. She suffers from chronic pain. She says her pain from head to toe is anywhere between a 7 to 8 every single day. She's on multiple meds, including controlled substances without relief. She was responding to certain biologics, but her physicians basically told her she can't do it for the rest of her life. She had to stop. And so she did her first treatment just a few weeks ago. So unfortunately, I do not have her, you know, her testimony as of yet. But it is something that has been a huge thing for her. She was referred to us by her pain physician. So by her pain doctor, he was also the pain doctor of that 22-year-old. And when he saw that 22-year-old walk in his office, he immediately called this woman and said, "You need to try this." And so she came in a few weeks ago and got hers.
Next question is, do you encourage patients to take any supplements to help support their bodies after the treatment?
Absolutely. So before the treatment, in order for you to kind of get the body ready, one of the things that we recommend is that we try to stimulate the platelet count to be as high as possible. And we do that using papaya leaf extract. And so we have everyone start on the papaya leaf extract approximately a week before. We also have them start the 24 to 48 hours beforehand. We ask that they try to take as much vitamin C as they possibly can. So they would take somewhere between 500 to 2 grams every couple of hours until their stomach gets a little upset. Then we tell them to back off to try to get the antioxidant effect in there so that you don't have the detox effect, you know, immediately following. We also do some IVs, like high dose vitamin C beforehand. Sometimes we do a vitamin bag, you know, a bag that has lots and lots of vitamins in it. Sometimes we do a hydrogen peroxide IV prior or post. We generally don't do the IVs post treatment for at least 4 or 5 days, just so that you know, because we don't want to dilute the effect of the platelets. And so we do them, we do recommend some people get them done the day prior though.
Okay. There's a doc in Bend, Oregon, Dr. Flattery, who claims to do PRP for sports injuries. Would he be worth contacting?
This is not like regular PRP. This is actually, so it depends if he's doing orthopedic PRP, which basically they only can inject 1 cc into the joint space. I know someone in that general area is doing TruDose PRP, but I'm not sure if that's the person or not, to be honest.
Fair enough. The next question is, will it help with periodontal disease? I am a dentist and interested to find out more about this.
There have been great reports on dental disease, yes. So, and we do know that in some circles in dentistry, biological dentists will do some PRP. Again, they are restricted to, if they're going to go into that space, they only can do 1 cc. Whereas if you're doing it IV, then you can actually do more. So it's kind of, and again, we can get more information on that. I know that, but I do know for a fact that it is being used in the dental realm for sure.
The next one, I believe you mentioned that there could be a Herx reaction or flu-like symptoms after the treatment. If that happens, can you provide the rough percentage of people who experience that, how long it lasts, and what to do to mitigate it?
So one of the things that we do to mitigate it, I'll go backwards first, is the high dose vitamin C the day to 2 days before, the papaya leaf extract, the IVs, you know, the hydration IVs, the high vitamin C. Again, it depends on your disease process. I'll just tell you from my experience, I did not prepare. I did not take the papaya leaf. I did not do the vitamin C beforehand. And it was really because I wasn't anticipating even doing the TruDose PRP that particular day. It just so happened that a patient didn't show up. And so we had an extra kit because the kits are super expensive, just so that you know. And they knew that I was having a lot of brain fog problems from post-COVID issues and stuff. And so they said, just try it, you know, it can't hurt. So like I told you, I had 2 weeks of fatigue, and that was, I'm sure that was a Herx. You know, what some of the things you could do is you could take baths with Epsom salt, baths with some hydrogen peroxide in there. You can take supplements with chlorella or with cilantro. Those actually help with some of the detoxing, to get some of the detox going. Again, it just depends on what you're detoxing. You know, if you're detoxing heavy metals, then, you know, you may have to do cilantro and chlorella. So that's just, it's a case by case thing, and we can help guide you on that for sure.
Next question is, I have 2 nieces with Lyme disease and they are in Florida. PRP sounds ideal. Will they need to fly to Dallas or St. Louis?
Well, I'm in Houston and I don't know, you know, we'd have to ask the TruDose people because they are opening up clinics all over the country. They had 23 starts in the last 3 months. So I don't know all the locations, but Florida, I would assume, is probably a good one. Depending on where in Florida, if they're in the panhandle of Florida, we're not very far away. We're about 8 to 10 hour drive, depending on where they are in Florida. So yeah, I think it's a good idea for sure.
Back to the bad arthritis with bone on bone. Are you seeing anybody that falls into that category?
That one woman does have that, yes. And she had, I think, only one replacement because her pain problems and all of her other chronic problems kind of mitigated her. She's not a good surgical candidate. Let's just put it to you that way. And so I think if you're not a good surgical candidate and you're suffering, why not try it? I mean, again, it at least it'll help some of the pain for sure. It may not completely remove it. It may help some of the inflammatory process, and it depends on how much truly how much cartilage is there, and you know what kind of, because don't forget too, with the platelets, there's some stem cells. So you know, it could deposit some stem cells there too, and it could help regenerate some of that for sure.
Yeah. So basically, yes, we are offering it in Houston, and then we're going to be offering it in St. Louis. The St. Louis dates are going to be August 11th. So Dr. Farella and her team will be coming up.
I mean, October 11th.
What did I say? Yeah.
August. He said August. It's October.
Thank you very much. It's been a really long week already. Yeah, so October 11th. So if you're interested in booking in the St. Louis office, call Heather Wall tomorrow at our main number, 636-751-9440. If you're closer to Houston, what's your contact info?
Our office number is 281-332-0500, or you can look at us online at ABT, as in A Brighter Tomorrow, the number 4 kids, KIDS.com. 281-332-0500 or ABT4kids.com.
Sorry, that's my deaf dog barking back there. Yeah, any last questions before we wrap up? Oh, so spell the name. I put the link of the website in the chat. So if you want to look further, it's on there. Next question. It seems like a lot of long COVID research says they're trying to keep things low platelet, anti-clotting, and we're raising the platelet count a ton. Is that going against this, or is there anti-clotting with it?
There's anti-clotting with it. Yeah, we have to make sure that you have anti-clotting in the specimens. So, but again, we're talking about healing factors. And so I had long COVID and I improved. I think, the long COVID thing is such a nemesis, because it may be reactivated Epstein-Barr, it may be reactivated Lyme disease, it could be mycoplasma reactivation. So there's a lot of illnesses that a lot of people don't know they have, that when they get COVID, it kind of triggers it and it reactivates. So in those cases, like Dr. James said, we work these people up, we make sure that they understand, that the workup is just as important, especially if we find that their workup has been lackluster. We do very extensive workups on a lot of our patients in Houston, and that is just part of it, and so I think with the long COVID, especially with brain fog, anxiety, things of that nature that actually are triggered by long COVID, I say give it a shot for sure.
Mm-hmm. Yeah. So if you're interested in doing that, give us a call. We'll get you on the schedule. We'd love to help you out. I just had goosebumps when Angie was telling us about the results they're seeing. This is just in a space that there aren't a lot of other great options. I feel like for the majority of people, or everything's been tried, or like those are the kind of people that end up in my office. They've been everywhere, and then they come to us last with very little hope. And so it's hard to turn that around, but that's what we see and that's what we do. And it seems to work out. So, all right. Thank you all for coming tonight. We appreciate it. If you have additional questions, you can hit us up on social media or email us hello@jamesclinic.com. And then one more time, your website.
ABT, A Brighter Tomorrow, the number 4 kids.com. So that's ABT 4kids.com, or 281-332-0500.
All right, y'all have a good night. Take care.
Thank you.
Bye.